Dr. Sabzina Sholieva. She is working at Rushan District Health Center as a family doctor.
این کسب به من خیلی هم معقول است چون که این کسب قریب که همه اختصاص‌های طبیبی رو در بر میگیرد و دومش این خدمت رسانی به مردم از وقتی تولد شدن همون کودک و همه اعضاهای عائله رو میتونیم گفتن تا وقتی فوتشون به آنها خدمت خود رو میرسونیم.
من میرزا و گلجهان طبیبی عائلوی.
Family doctors. They are reaching a new position in our health system. Through continuous medical education, they improve their knowledge.
من شریف و سلطنت همشیره طبی عائلوی.
Very important in family medicine are well-trained nurses, particularly in remote regions where doctors are far away.
من شولی و سبزینه طبیبی طبی عائلوی هستم.
Family doctors use new technical equipment, and in this way they are able to cooperate with specialists in hospitals. Dr. Guljahan Mirzoyeva. She worked for 14 years as a pediatrician at Muminabad. 3 years ago she was retrained and became a family doctor. To feel more confident with adult patients, she still improves her knowledge. In the Clinical Excellence Center of Khatlon, initiated through the Family Medicine program, Dr. Guljahan had the opportunity to discuss once a month important topics with other specialists.
در اینجا موضوعها بسیارتر ما درباره بیماری‌ها صحبت می‌گذرانیم. زنانه هم هست، کودکانه هم هست. درباره بیماری‌های درونی، سیرویتی ما در اینجا سمینارها می‌گذرانیم.
Dr. Murad Bek. He works in very different conditions in the remote village called Gojovast in Vanj Valley. Since 40 years he works in this region, first as a therapist, since 7 years as a retrained family doctor.
مردم ما پیشتر خیلی بودن عذاب میکشیدن همینجا به رایون یا به دیگر طرف های قدر روی دروازه و یا صرف میکردن خرج میکردن. حاضر تیبولی و یا کم خرج صفت نوک همش سری وقت یاری کمک تیبی را میگیرن در خودی خانه‌اش.
But Dr. Muradbek does not only treat the patients. Together with his family nurses and community health promoters, he invests a lot of time for disease prevention of the villagers. Abdullayev Yunus is a community health promoter. As a volunteer, he learns from doctors' work and from different courses basic knowledge about health promotion and disease prevention. What he has learned, he passes on to the people of the village.
بسیار خوب است که من حضور می‌سیمه رو در اینجا بسیار گذشته استفاده مردم ده بسیار کسالی و از بسیار نمودی من 25 از آگاه هستند.
مثلا این کسالی هایی که بسیار چی میکردن مثلا این کودک‌ها بسیار شکم را میشنن و بعدش همین کسالی ها استوسا کم شدن. همین سبب یکم کسالی همین جیبارهایی که افلاس هستن آنها رو تازه میکنیم همه وقت.
Family medicine is devoted to provide high-quality health care. Very important are working conditions and the equipment. The program has helped to improve both buildings and medical equipments in health centers. Here is the small village Dursher in Vanj Valley.
بینوی ما بینوی آورینی بود. خیلی نمیخواستیم که ما اینجا بشینیم کار کنیم. حاضر خورسندی ما امینه که بینو این نو زمانوی خشرو برای ما ساختن تجهیزات‌های نو آوردگی همه خوب قبول کردند.
A particular challenge is the good health service in the remotest regions of Tajikistan, for example in the Murgab district. Saltanat Sharipova is a nurse who cares mainly for pregnant women and newborn children. She does it in Bashkumbez, her home village, but she also visits the patients in remote nomad settlements. The nurse does her job with passion since 35 years. In the yurts, she controls the health of these pregnant women, but she also serves all patients.
Здесь это распространенные больные, это только это гипертонические больные у нас. Это высокогорье. Высокогорье, если вот он диету не соблюдает, в жарении это все много покушает, после этого гипертонический бывает.
A big problem are often the costs of the medical treatment. In the village Siponj in Bartang Valley, volunteer Navruz Baudurov founded and organized the community-based health financing scheme. The start in 2011 was difficult. However, the villagers have learned to see the benefits of such a scheme. Today, all households take part in the scheme, which helps to cover emergency transportation or even diagnostic costs. But not only for the villagers, finance is an important topic. The project makes essential investments to improve planning and management capacities of primary healthcare managers through business planning.
Business و نقشه با ما فایده آورد که در رفت کار با این پلان بازی بودجت ما پورا معلوم است و ما این رو از روی اهالی با بنگاه‌ها و مرکزهای سلامتی جدا کردن می‌توانیم و این رو همچنین ثمرناک استفاده بردن می‌تواند.
In the district health center in Rushan, Dr. Sabzina Sholieva is an experienced family doctor since 7 years, and she serves her patients in the very best way. If she is not totally sure in her diagnosis, she regularly contacts medical specialists. For this, she can use e-health consultation with a specialist at Horog Hospital. Today, with neurologist Dr. Zubayda Agdodova.
مثل مرکز قطعی مشورت میگذارونیم متخصص بود چقدر میفهمونم و
For Zubayda Agdodova at Horog Hospital, e-health is a very efficient method. It helps the family doctors but also the patients because they can get help in their district and do not have to travel long distances to hospitals or only if it is really necessary.
پیش که دکتر سبزینا پیشکی تشخیص نمیمونده قطعی ما اول مشورت میگرفتند وقتای آخر уже دکتر سبزینا خودشون میتوند به همون مریضش تشخیص موندن میتواند باورناک طبابت هم تعیین کردن.
With this method, family doctors can do a maximum of their patients. Health is a fundamental human right vital to other human rights. According to WHO, a well-functioning health system is built on having trained and motivated health workers, a well-maintained infrastructure and a reliable supply of medicines and technologies, backed by adequate funding, strong health plans and evidence-based policies. Given this, it is important to maintain the very successful key element of the community-based family medicine program.